Hi guys, I apologize. I couldn't get Kaltura video to work on my computer. Somehow deleted itself, so I'm just using the photo booth app. Hopefully it comes up okay for you guys to view. So I chose to make my first video blog on the healthcare disparities facing children with asthma. And even though incidence of childhood asthma has plateaued for the first time since 1980, asthma outcomes remain disproportionately affecting certain racial, ethnic, and socioeconomic groups. And this is according to a publication in 2017 published in the Journal of American Academy of Pediatrics by Volerman, Chin, and Press. In this article, they discuss the incidences of asthma related to emergency department visits, hospitalization, and mortality rates, all of which are disproportionately affecting African American and Hispanic children compared to white children. It's been found that African American kids have a 2 to 3 times higher rate of hospitalization and ED visits compared to white children, and a 4.9 times higher asthma mortality rate compared to white children. Hispanic children face similar disparities, a little bit less. They have a 2 times higher likelihood to visit the ED and a 1.5 times higher mortality rate. We're seeing these statistics due to a multitude of reasons. They're very multifaceted, including limited access to care environments, especially primary care, and specialties like pulmonology for kids with complicated cases. You're looking at poor health literacy rates in these populations and higher amounts of indoor allergens due to less than ideal living conditions that are often found in lower socioeconomic areas. So really there's quite a snowball effect of things going on here that are leading to these disparities and these poor outcomes. Families of these children are often limited in their ability to arrange for health maintenance appointments due to scheduling demands, often in single-parent households that are certainly found in higher rates in these areas. This is all information from that same article published in the American Journal of Pediatrics. Black and Hispanic children are also, interestingly enough, found to be prescribed maintenance medications for asthma much less than white children. And as we know from our last semester studies, maintenance medicines are pretty much a mainstay of the stepwise approach to treating asthma. Right after the rescue inhalers, it's really important to have those daily medicine coverages so that you can avoid exacerbations, ED visits, and mortality in the event of an extreme asthma attack. The first step in managing and reducing these disparities is really understanding what asthma is and the true condition. And so teaching becomes a really important aspect of this healthcare issue. So disseminating information to children and families that are already hard to reach and hard pressed for time, they can't get to primary care, is really important that we can deliver this information in a way that's usable and functional for them. And so as I was reading, a lot of programs, a lot of housing authorities and school systems have partnered with case managers and asthma educators to try to get information out there, possibly coordinate with school-based health clinics, and just make this kind of care more affordable, more accessible. There's some incidences of community outreach events, but each of these events appears to have a limited and pretty localized effect. There's no one comprehensive program that addresses the multifaceted nature of this condition and decreasing its incidence in the pediatric population. A great resource for parents is actually just right on the CDC website, which in a technology-savvy society, we're finding that this is at least a first step for families in order to start understanding this condition. They have a lot of resources on what asthma is, the general management of it, how to access and formulate an asthma action plan. And the good thing about this website is that all the resources are available in multiple languages, and so that can be really helpful for families that have limited health literacy due to English as a second language. YouTube was also mentioned in the studies as a way for people to hear information in different ways, see different representations, possibly get some diagrams. But like anything that's on social media and social platforms like that, you just have to be careful of where your information is coming from. So it's important to counsel our patients on that if we can access them, giving them possible good accounts that come from reputable sources if that's a way that they prefer to learn. A personal experience that I have with pediatric asthma and the disparities that children face with it is one of my good friends from childhood. She's African American, and she's had asthma for as long as I've known her, pretty much since first grade. I always thought she was just unlucky, but as we have grown up and as I entered the healthcare field, we really started to flesh out all of the factors that went into her developing asthma and developing so many complications and now dealing with it as an adult. So she grew up in a single-parent household, and her mom worked 2 jobs growing up just to prioritize the safety and security of her family. And so accessing primary care services and specialty services that my friend really needed wasn't high up on the priority list. Her mom also smoked inside the house, coming from a country, immigrating from a different country that didn't have the same health standards. This wasn't really a practice that she knew to be especially harmful, and now she does, but my friend is now living on her own and not smoking indoors. And so now her asthma is managed. She's on a lot of daily maintenance meds, but looking back, we realized that this really could have been a preventable condition for her, and that it's important that going forward she realizes how important it is to prioritize her own health and safety, access those primary care services, and going forward with her family, she knows how important those things are in order to preserve quality of life. So that's the end of my first video blog. I hope it uploads appropriately, and I can't wait to see what everyone else has posted about. Thank you.